What are some good questions that you can ask your OB during the first trimester of your pregnancy? During the first trimester, it may be the first time that you are even pregnant and you're not sure what's going to happen. So the questions you can ask the OB are basic ones, maybe for them, but not so basic for you. It helps you be able to make better informed decisions. So for example, you may want to ask your OB, how often do I need to come for prenatal visits? Usually it's once a month, but there could be exceptions if you have certain medical conditions or you're more high risk and you would need to come in more often. So ask your OB, with these medical conditions, do I come in more often or do I come in once a month? Another good question would be, will I be seeing you, the OB, at every visit, or will I be seeing a nurse or a nurse practitioner? That may make a difference to you, and it's really important for you to get that information because although nurses and nurse practitioners are very competent healthcare providers, they have different training than an OB-GYN, who is a medical doctor. Another question you could ask is, what kind of tests will be done during the first trimester? Usually this involves more of what we call sonograms that are able to determine genetic conditions. So if there are problems with your baby's development while the baby is developing in the first trimester, a sonogram will be something that can pick that up. Once you have that information, and if it's not good news, you can make an informed decision about how you want the pregnancy to continue or not to continue. What blood tests, what other urine tests are you going to be getting? These are important tests, especially blood and urine, which can show problems. For example, you could have high sugar in your urine, which could be an indication that you have what's called gestational diabetes. Now, that means that maybe you're not a diabetic when you're not pregnant, but for some reason, and we don't know all the answers as to why, some women develop diabetes while they're pregnant. It continues through the pregnancy and it goes away after they deliver. But certainly checking your urine can determine whether you have high sugar. Your blood can also be a good indicator of some kind of genetic problems in the baby or problems with yourself, like are you anemic, which means you're not making enough red blood cells, and that can be very important for the health of both you and your baby. The other thing you would want to know is if you have any kind of bleeding or cramping or spotting, what should you do? Should you call the OB? Should you go right to the emergency room? What is worrisome cramping? What's worrisome bleeding? These are things that would be a good idea to have a discussion with your OB during the first trimester. So if you ask some of these questions, you will be a more informed patient, and you will also be able to get some of these answers. It may actually relieve some of your anxiety and your uncertainty about what will happen. So remember, it's your body, you're right. Ask a lot of questions. The more information you have, the more informed patient you are, the better decisions you can make for both you and your baby. Thanks for watching this video. Please hit that subscribe button and hit the like button. That way you can take advantage of all of my videos. Please also go to my website at frankspectorlaw.com. On my website, I have lots of great information about medical malpractice and birth injury. I'm always updating my website, so I encourage you to come back often. Thanks again for watching this video. I look forward to seeing you again on a future video.